Hi Janice, my name is Adrianna and I'm Dr. Smith's nurse. I understand that you're 7 months pregnant and Dr. Smith has recently diagnosed you with iron deficiency anemia. Is that correct? Okay, so today I'm going to give you information on what iron deficiency anemia is. It's also known as IDA. By the end of our appointment today, I would like for you to explain to me in your own words what IDA is by recalling the optimal daily intake of iron. Can you explain to me what you already know about anemia? Not much? Okay, that's fine. Do you know what the most common treatment is? No? Okay, the most common treatment for iron deficiency anemia is changing your diet and increasing your iron. When some people think of iron, they think of metal beams that are infused with iron to make them strong. People need iron to stay strong too. Iron helps red blood cells carry oxygen to the body and plays a vital role in the brain and muscle function. A lack of iron in the blood can lead to iron deficiency anemia. Every red blood cell in the body contains iron in its hemoglobin, the protein that carries oxygen to the body's tissues from the lungs. Iron gives hemoglobin the strength to carry oxygen in the blood so that oxygen gets to where it needs to go. People who become iron deficient aren't getting enough iron in their diet. This means that the body can't make hemoglobin, so it makes fewer red blood cells. This is a condition called anemia. When someone has anemia, less oxygen reaches the cells and tissues and affects how the body works. Signs and symptoms of IDA include fatigue, shortness of breath, dizziness, and mouth sores. Are you experiencing any of these symptoms? Yes? Okay. So the important thing to note here is that if IDA is not treated appropriately, there's an increased risk for delay of intrauterine growth, stillbirth, preterm delivery, and low birth weight. These severe risks can be significantly decreased by increasing your daily intake of iron. The recommended daily intake of iron for a pregnant woman is 27 milligrams a day. I have printed off some handouts for you to take home that list foods rich in iron. So here is the handout. There's a ton of foods that are rich in iron, and it gives you how many milligrams are in that food. How many milligrams of iron is in that food. By having these lists, you will be able to choose what foods you like, which will make changing your diet a little bit easier. Increasing your daily intake of iron will benefit you by reducing the severity of your symptoms and minimalizing the severe risks of IDA. Lastly, I've printed off a website information called MyFitnessPal. It is super amazing. It's really good at helping with meal planning and also tracking your progress. So Janice, we have covered a lot of material in regards to your new diagnosis. Do you have any questions for me? No? Okay, can you tell me in your own words what iron deficiency anemia is? Excellent. And how many milligrams of iron should you be eating in a day? 27 milligrams? Perfect. What are some benefits for you and baby of increasing your daily intake of iron? Symptom reduction and decreased fetal risks. You got it. Janice, it has been an absolute pleasure meeting you today, and I hope that you really start feeling better. Give me a call. I'll give you my card. Don't hesitate to call me if you have any further questions or concerns, and I'll be in contact with you over the next couple days to make sure that meal planning is going okay for you. Take care.